Welcome to UK Care World. Today we will learn about diabetes. Let's start.
Hello and a warm welcome. This explainer is for you, our fantastic care workers and care support workers. We've put this together to give you some practical, really useful guidance for providing the most effective and empathetic care to the people you support who are living with diabetes.
So here's a quick look at what we'll cover. We're going to start with the basics of understanding diabetes, and then we'll look at the main goal, which is managing blood sugar. But, the most important part is how we connect those medical facts to the real-life, day-to-day world of the people you care for. And that's where we'll see just how vital your role really is.
All right, let's dive right in. First up, understanding diabetes. Why is this so important? Well, it all starts with getting a clear picture of what the condition is and just how many lives it touches.
At its heart, diabetes is a long-term or chronic condition. All it really means is that the body has a tough time controlling the amount of sugar in the blood. And because it's a lifelong journey, it needs that constant, day in, day out management to keep serious health problems at bay. That's where your steady, consistent support becomes absolutely crucial.
To really grasp why your role is so important, just take a look at the numbers. It's kind of staggering, isn't it? In 2021, more than 500 million people across the globe were living with diabetes. This isn't some small issue. It's a massive global health challenge. And you are right there on the front lines, helping people navigate it every single day.
And that number, it's not standing still. It's actually growing. By 2045, it's expected to climb to almost 800 million. So what does that mean? It means more and more people are going to need the skilled, compassionate, and knowledgeable support that you provide.
Okay, so if the main problem with diabetes is blood sugar, it makes sense that the number one goal is, managing that blood sugar. Let's take a look at the evidence, at what the numbers tell us about why this one goal is just so incredibly important.
Now, you've probably heard this term thrown around by doctors or nurses, HbA1c. The easiest way to think of it is like a long-term report card for blood sugar. It doesn't just give you a snapshot of one moment, it shows the average over the last 2 or 3 months. For most people, the goal is to get that number below 7%, which is a great sign that things are well controlled. And this is what's so exciting. This slide is proof that support works. It really does. In this study, one group got extra education and support, exactly the kind of thing you help with. Before, 120 of them had their diabetes under control, but after, that number jumped up to 151. It's just clear, solid proof that your guidance and encouragement lead directly to better health.
And the payoff for getting that control? It's huge, absolutely huge. Research shows that even a tiny improvement, getting that HbA1c number down by less than 1%, causes a massive drop in risk. We're talking a 25% lower risk of certain complications and a 10% lower risk of mortality from diabetes. Small changes in numbers lead to huge changes in life.
Let's make this even more real. Think about this. When someone has their blood sugar well controlled, their risk of developing a serious eye disease that can cause blindness drops by over 32%. So every time you help someone with their diet or medication, you are literally helping to protect their eyesight. And it's the exact same story for their kidneys. Good control means a risk reduction of more than 36% for early kidney disease. By supporting someone to stay on track, you're helping protect their vital organs from damage down the road. It's that important.
Okay, we've talked about the clinical goals, we've looked at the numbers, and they're all incredibly important. But now, we're going to make a really crucial shift. This is where we step out of the clinic and into the real, everyday life of the person you're supporting. So let's ask a really important question. While a doctor is focused on that HbA1c number, what is the person with diabetes actually thinking about? What are the worries that are really on their mind? As you're about to see, their priorities aren't always what you'd expect.
And this right here, this is a real eye-opener. On the left, you've got the typical things a clinic focuses on: exercise, meds, monitoring. But when researchers looked at thousands of online chats between people with diabetes, a totally different picture emerged. Their biggest concerns were things like diet, money worries, and a subject that almost never comes up in a doctor's office: sexual dysfunction.
This quote, it just brings that financial burden point home in such a heartbreaking way. This is from a wife whose husband couldn't work anymore because of his diabetes. The stress isn't just about the illness. It's about losing an income, worrying about the mortgage, and the unbelievable strain it puts on a family.
This is the hidden reality.
And then there's this, a topic so often left in the shadows. Sexual dysfunction is a common side effect of diabetes, but it's incredibly hard for people to bring up with a health professional. So where do they go? They go online. It's a source of huge anxiety that often stays hidden from the very people trying to help.
So you see, we have the clinical goals on one side and these deep personal, hidden worries on the other. And this is where you come in. As a care worker, you are the bridge. You're the one who can connect those two worlds.
And I really want you to hear this loud and clear. Your role isn't just a nice to have. It is proven to be effective. The research is clear. When someone with diabetes has support from a whole team, and that includes you, their blood sugar control gets better. Your support helps reduce complications. You are that vital link between the doctor's advice and a person's actual, real life.
So what does this look like day to day? Here are 4 simple, powerful things you can do. First, listen for those hidden concerns. Ask more than just about their numbers. Ask, how are things really? Second, create that safe space where they feel they can ask you about the tough stuff. Third, keep doing the brilliant work you already do, supporting their diet and activity. And fourth, remember that you are the expert observer. You are the eyes and ears who can spot little changes and report them back to the team.
Okay, let's just quickly bring everything together and recap the most important takeaways from our session today. So, if you remember anything, remember these 4 things. First, diabetes is so much bigger than just blood sugar. It touches every single part of a person's life. Second, good management, with your support, makes a massive difference. Third, a person's biggest worries might be the ones they never say out loud. And finally, your empathetic support isn't just a bonus, it's a critical part of their success.
Please, never, ever underestimate your impact. The support you give every day, the listening, the encouragement, the practical help, it all makes a direct, positive, and measurable difference in the health and the quality of life of every single person you care for. Thank you so much for your time and for everything that you do. The work you do is just incredibly valuable. We always want to make our training better, so we'd love to hear any feedback or comments you have about this session. Thank you again.
Did you learn something today? Watch more videos and subscribe the channel.